welcome to the fifth episode of OptiSphere, a podcast channel by Opti Consult Me, where we bring you stories, insights, and conversations with inspiring professionals from the world of eye care. I'm your host, Ms. Neha Chaurasia, and today we are truly honored to be joined by a remarkable guest, Dr. Premnandhini Sadgunam. Dr. Premnandhini Sadgunam is someone whose journey is as inspiring as it is impactful. From the Elite School of Optometry in India to Harvard Medical School in the US, she's blended clinical work, research, and global experience to push the boundaries of vision science, particularly in binocular vision, functional vision testing, and vision rehabilitation. She is also the mind behind innovations like the pediatric perimeter, a novel device designed to assess visual fields in infants and patients with special needs.
Dr. Premnandhini, welcome to the podcast. We are so happy to host you.
Thank you, Dr. Neha Chaurasia, and happy to be a part of this.
Thank you so much, ma'am. So let's start from the beginning. What got you interested in optometry? And how did your journey take you from India to the US?
Okay, so first of all, I think I joined optometry school in 1995, and at that time there was no Google or Yahoo. So I think these days students have a lot more exposure and they have a lot more awareness into what they are getting in. But in my times, it's mostly through word of mouth and friends. So it's optometry is not something very mainstream, at least at that point in time. So I got into the course because one of our family friends, some known person, was actually doing optometry, and also my neighbor. And what got me attracted into the course was two reasons. One was at that point in time we had an affiliation with Pilani. Uh, this was with Elite School of Optometry in Shankar Nethralaya, and which is a very prestigious name. So I was for sure knowing that this is a good program to join. And the second reason is it combined both mathematics and biology, and those were two of my favorite subjects. So I thought that's a good combination to have as well. Because if you go to med school, you sort of have to sacrifice mathematics, and you go to engineering school, you sacrifice on biology. So I thought this is a good combination sort of a course. So those were the motivating factors to get into optometry school. Once after I finished the optometry undergraduate degree, then I worked as a sort of like a faculty, like a clinical faculty at Elite School of Optometry. So I was teaching and also seeing patients. And I did that for 3 years. And in that course of 3 years, I realized that, certain things that you sort of study in textbooks in black and white print necessarily does not hold true when you see real cases. So there are things that will contradict what you have learned. And also, I was interested in binocular vision and vision therapy, all of that. And we had a patient, he was actually a sixth grader, and he had nystagmus, and it was sort of idiopathic. And his father would actually was working in IT profession at that time, and he would try to collect information, do research, and then we would look up at things that he has brought, and we would try to sort of see what we can do differently. And we used to give therapy on synaptophobe. So in that process, I realized that if you have to help patients, then you have to expand your scope. You have to probably do research and understand conditions at its fundamental level. So that's what pushed me and made me realize I need to do higher studies or do research. And that's what took me to the US after 3 years working as a uh, faculty at ESO.
Great. So you had some worked in some incredible institutions across the globe. So how did studying and working abroad shape your perspective on eye care and research?
Definitely, it had a huge impact. And so, first, I did my master's and PhD at Ohio State University. That's like one of the oldest institutes in the US, land grant university, as they call it. And the good thing is that it's a university setup. So, it actually gives you sort of like exposure to a lot of different spheres. And there are common student programs that brings in world leaders, Nobel prize winners, and you hear their inspiring talk and all of that. So this makes you sort of open up your mind to a lot of things that you can do. And within the university is the College of Optometry, and I had great mentors over there. So my master's and PhD advisor, Dr. Nick Fogg, was somebody who was very hands-on. He would build things on his own. And so that got me to realize that you have to be very hands-on if you have to do experiments. And of course, the culture of research and the rigor in which they do, and the professors who teach the students there, because I also was a teaching associate over there, and you realize that the ones who write the books, the authors of the books, are the ones who are teaching in those colleges. And it made me realize that while I was teaching back in India, it made me realize how inadequate I was when I was teaching, when I just saw these people teach. So I think it exposed me to a lot of different things, and it definitely did shape up how we think and understanding the depth of research. So all that was good. And then I always knew that I was going to come back to India because the need for eye care, and how both for optometry in terms of teaching and training our people, and also the needs of the country was there. So there was no point in staying back in US. So I knew I was going to come back. So after finishing PhD, I wanted to do a postdoctoral training, and my master's and PhD was focused on more basic science questions of looking at saccadic eye movements and Virgin's eye movements. And I used this instrument called scleral search coil, which is actually like a scleral contact lens with a wire running out of the eye. It's actually a bit painful device to wear it and do tests. And I definitely knew that that's not something I can take back to India. So I wanted something a bit more practical. So which is why I chose to do a postdoctoral training in a little bit more clinical aspect. And I joined Professor Eli Pelly at Staples Eye Research Institute in Harvard Medical School. And that gave me a direct access to sort of work with patients. Prior to that, because I was doing on basic science research projects, it was more with student population and controls. Remember that my sixth grade patient who pushed me into research was having nystagmus. So that's the interest in which I went with eye movements. And with Ellie, I was looking at low vision patients. So it was sort of like a good combination that I had. And after finishing the postdoctoral training, then I decided to come back to India and join an institute where research would be the primary focus. So therefore, I landed back in LV Prasad Eye Institute in Hyderabad. Neha, sorry, I think you're
Yeah,
muted.
sorry. So we are aware that you joined LV Prasad and still continue to be part of the main research forum there. So you, for people like for the young generations who want to get into research but have no idea, like because the question comes to our mind, the first question which I always get it, that if I get into research, where is the money? Like what is the gain I have through the research, though I have a lot of interest in that, how to go about the grants, how to what is the step by step process to people, optometrists who are interested into research work can also explore a lot of opportunities in India. Why? Because what we know is abroad you get a lot of opportunities. There's a lot of because optometry is a known uh, profession there. But in India, it is difficult to for optometrist researcher to go into it and reach a pinnacle. So, what is the step by step process for the same?
Okay, so first thing, when somebody says that they want to do research or they don't have any idea about it, first thing is you should know why you're doing research. Okay, that has to be, I think, it has to be very inherent. You cannot be doing research because, oh, you see somebody else has done it or they have doctor in front of their name. Sometimes I hear people say that they want the doctor in front of their name, and that's like the worst reason you want to do research. Okay, so that's one. So first, get to know why is it that you want it. See, it took me 3 years and a realization to sort of realize that I have to do research if I want to be a better clinician. I would say that's what pushed me. So to me, in my mind, I don't see clinics to be any different from research because my research questions are very clinically oriented, and I am in the clinic, and that's where I get my inspiration to do, okay, what is it that I want to improve for my patient care, okay? So I don't see this as two very distinct things. Now, you made a statement to say that abroad it's much easier, but actually it is not, because if the goal for somebody is to earn more money, they get a lot more money through their clinical practice. So even abroad, they don't get very many people getting into research. Okay, which is why I think there were opportunities for abroad people to hire people from outside of US, because they couldn't fill those seats with their own local people. Okay, so the clarity for that goal should be very clear. What is it that you want to do? If you think that, okay, I need to be financially stable, you can look at choices. And optometry is a great profession because it allows you different choices in different spheres. So see where is it that you can actually have establish yourself with greater financial stability. Okay, so if that's the priority, go for that and look into aspects and different spheres of work through which you can make yourself more financially secure. But if you are more keyed towards, okay, I want to solve something, I want to understand this more, explore more, provide solutions, generate new knowledge, then you're a research material. Then you're looking at, okay, how do I build a research career, right? So this and as you said, you will definitely make more money if you're going to have that clinical practice, versus in research we don't earn money as such. Okay, and if you have to do research, you have to write those grants. And in fact, abroad, it's much more competitive to get the grant, one. And two, as an optometrist, unless you have a clinical license to practice, you cannot be doing clinical research abroad. So you might actually have to be doing more basic science research, which you can, and you can get grants for that. But you need to know that it's not as easy, and it's not easy anywhere in any part of the world. Okay, it's going to be very competitive. So if we are in India and we are applying for grants, we are pitching against people who are writing grants for tuberculosis, cancer, all of that. Okay, so you need to know where you want to spin the ball, and where you think you can make an appeal. And the good thing in India, I think, is also because there are a lot of other opportunities for funding, not necessarily through government grants. You can also have some CSR funds. But the caveat there is that they might be more interested in doing service delivery sort of projects. So school screenings, those sorts of things might get funded a lot more than understanding, for example, the pathogenesis of keratoconus, say for example. Okay,
Yes.
so you're going to be in a conflict over there. But there are certain industry grants that are there, and if you're able to convince them, then you could get some grant for that. Okay, in my case, my major grant support has been through government agencies. But the nice thing presently in India is that they set out or cut out some grants for innovations and product development and all that. So you could sort of mix that in, and then you could also sort of study some fundamental science questions through by building some devices where you think it will eventually have a clinical translation. So I think the biggest challenge in India would be to do pure fundamental basic science research. uh, for that area, maybe outside of India is probably a bit more easier. But if you have to be in India and do research and get grant money, then you are looking at very clinical research questions, or at least something that has a more translational relevance. So that's the area in which you could apply for grant.
So from here, I got an idea that public health researchers get more acceptable, and they get grants compared to if you go into the clinician side, or it is the clinical research is more given preferences in eye care.
Yeah, yes. I mean, let me also make statements that are more clarified and politically correct. Okay, so it's not like public health researchers will get a grant very easily, because they have their own competition there. Somebody might say that I'm going to do a public health screening for tuberculosis again, and I'm bringing up TBs because that's one of the things which is more endemic to the country, and people are constantly struggling, especially with antibiotic resistance and all that. Okay,
Yeah.
so we have our own individual fights, and for as a country, as a priority, they might prioritize and give it to different sort of like, they might pick up a certain disease and say this is of interest for us and this is what we want to deal with. So if you're only going to bring in the eye aspect as such, okay, you may not be able to be very competitive. But say, for example, in my case, because I do baby vision testing, but
Yeah.
if I'm going to tie in with child health and maternal child health sort of a domain and convince that I'm looking at a bigger picture, then I could sort of make a little cut and enter that competition. Okay, so it's also how you package the story. And vision is actually a very competitive field because everybody agrees that blindness is one of the most major feared sort of condition next only to cancer. Okay, many people fear blindness, so there is always an appeal when you say that you're doing a study and it's going to prevent needless blindness and all of that. Okay, so people still do have that sort of like a little advantage because you don't have to convince too much to say that I'm fixing blindness. People easily get convinced on that. But the competitive advantage is also that if you are a very newcomer, okay, very fresh in this competition, then you have not really built your CV and you may not be viewed very competitive when compared to somebody who has very well established programs and a whole sort of publications to go with it, because obviously somebody is going to say that that's a more reliable source, I'm going to fund them. So building a research career actually takes a lot of time. Okay, it's not like, okay, I'm fresh out of my training, let me open up a clinical setup. Within 3 months, 6 months, you probably pick up. Your patients are very happy, satisfied. They bring in their friends, relatives. Okay, and that's how your reputation as a clinician is going to build up. And maybe within a year or two, your business practice or clinical practice might pick up fast, and you might be very good on it. When it comes to research, it's not going to be that quick. Okay, that's because each paper, a good paper, and getting it published in a good journal, not predatory journals. Okay, so very good reputed journals takes time. Okay, one paper could take almost 1 year for you to see it out in print also. Okay, so it's going to be a slow process, which is why people go through PhD, then go through postdoctoral training, then they have get a hands-on experience working with experienced researchers, then they learn some tricks, then they come back and they apply, and then they sort of build it very slowly. So it's going to take almost, it has taken me, I said 95 I joined, 99 I finished my undergrad, and it's taken me this long if to come to some position, and I'm still learning. Okay, I wouldn't even feel like I'm an established researcher as yet. I don't think I feel myself as an authority as yet. Okay, so people should be willing to persevere. Okay, so one thing you need in PhD is not even so much on intelligence, it's more on perseverance and handling those rejections in grants and papers. Okay, and I've had a lot of rejections, and but sustaining and trying to bring it to a fruition. That's where the strength of a researcher is. Mentally you should be that strong and be willing to realize that there will be a lot of failures in this. It's a lonely journey. Okay, so for whoever is listening, and if they want to sort of say that, okay, I want to be a researcher, it might look very glamorous because you will call keynote speakers, they are presenting it 5 minutes, 10 minutes in conferences, you may see their face often. Okay, but the background to where they are at that point, that background journey is a very lonely journey and it takes time. Okay, you really are making some meaningful difference. Okay, so the good thing with in being a researcher, I think in my mind, is we are reading papers and some discoveries of some people who are dead like 400 years back. Okay, and we still are building on their foundation.
Yeah.
So sometimes, many a times, the papers that you publish, you may not even know what it is worth for. But maybe if it is very robust and well-established research, good outcomes, then maybe 100 years or 200 years down the line, you're still living through your paper. Okay, and you have made some contribution to that field. So that's the impact of it, which you cannot put a monetary value. Okay,
Yeah.
so these are very different sort of uh, I suppose domains, apples and oranges, right? So
Yeah.
the financial viability is not something you can tie in. But again, the other good thing I would say in optometry is the research that you're doing, right? It's not very cost intensive. Okay, we are not buying reagents, we are not buying test tubes. Okay, so if you have a good idea and within your own clinical setup, if you know how to do a rigorous research, then you actually could go ahead and do it. Okay, so it's not very cost intensive that way. So that's the good thing, at least in our field.
Yes, you've taken one of my questions. You already answered that question about, how to go about the research part and why publications are tougher. But coming back to these, combinations, if when we talk about the financial stability with research, if suppose somebody is so much into research, and as you said, it is a matter of perseverance and lonely journey. I totally agree with that because initially when I started my research, I thought, ho jayega, it is possible. But then I wanted to give up a lot of times. Um, how do you combine at your clinical work? Suppose you are in retail, also maybe you are in a clinic, and you still are into research. And how do you actually merge these two and simultaneously work on these? Suppose I'm into retail and I like progressive lenses. I can work on a progressive lens project. So, what is the funda of combining these two eras, research with your clinical practice or with whatever practice you're doing as an optometrist?
Right. So I cannot comment so much for retail because I've never had that experience at all. But I can talk from the point of view as being in the clinic. Okay. So
Yeah.
if I'm in the clinic, I'm only a clinician. I'm not even thinking about research, even though I might get patients who probably are a part of my inclusion criteria for a project that I'm doing, but I'm not a researcher at that point in time. I'm only thinking about clinic and doing clinics, right? So first thing is, I think we should probably dichotomize the days, okay? Because when I'm not there in the clinic and when I sit as a researcher, then I'm looking at, okay, this is all the things that I need to do. There is a protocol, how you measure visual acuity, everything is going to change between when if you're in clinic versus when you are in doing as a part of a research. So for example, visual acuity itself, right? So in the clinic, when we do visual acuity, we will ask the patient to read. They might read a CS and O, or they might call out some other letter. Whatever mistake they make, you will ask them to repeat it. Read that last line again one more time because you want to make sure that they missed it out. But if you are in a research mode and if you are doing that acuity, you should never be doing that. Okay, you will tell them, okay, what's the next letter? If they read it, they read it. Okay, you're not giving them a second chance there. Okay, that's the rigor of the protocol. So the ETDRS protocol for measuring visual acuity requires you to do that. Okay, and that's how you should do it. Okay, so you see, very something that we always use, visual acuity. So I cannot take it from a clinical record because I don't know how it was recorded. But if I'm doing it prospectively, then exactly I know how it is recorded because I followed a protocol. Okay, so this is very important. Otherwise, we are going to, if we mix up things, then it's going to be very noisy and you're not going to get any clarity in the outcome that you're trying to see. Okay, so one thing is when I'm in the clinic, I am thinking more critically, okay, because my research training, I was saying that when I'm in the clinic, okay, my research training has allowed me to think critically. So I'm not superficially or mindlessly working up a case. I think through and I find out, okay, why is it that they're missing these letters on the right side? Or I'm critically probing a bit more, okay, till I'm very satisfied with the patient outcome. And that critical thinking is a benefit I have because of the research training that I've had, or I'm trying to solve something which is not feasible, right? I'm not giving up on the case and saying, yeah, in some patients this is what will happen and leaving at that. Okay, I'm trying to find some bit more answers to this, right? And when I come to research and when I'm in the research mode, I'm thinking, okay, these are the clinical questions which I couldn't get a satisfactory answer. Can we do this better? Okay. So to me, clinic and research are truly two sides of the same coin. Okay, so you become a better researcher by being a good clinician, and you become a good clinician by being a good researcher. I think that's what that combination in my mind. I'm not saying everybody needs to do it this way, but in the way I have had my journey, that's what I have learned. So in a paper in a work that we did on spasm of near reflex, we were able to come out with a whole new protocol for managing this condition because we addressed it very systematically through research. Okay, so I think it's important to sort of combine that in case if you want to solve the problem. Otherwise, what we do, if we are only as practicing clinicians, we look up for answers from the research and we say, okay, presently we manage spasm with atropine, and that's what you're going to refer to, right? So now there is yet another protocol, and that came through from research, but the research question came from the clinic, right? So that's how they all are intertwined, I would say.
Mhm. Totally agree with this. For all the researchers out there, it is important that you work on your research, but you have to be a good clinician. And I totally agree to this point that clinic and research are intercoined together. Now, coming to a lot of publications what you would have done, and you said already that it's the waiting time is too long. Uh, is there any, mantra what you can give or ideas to our audience, to our new generation of optometrists? How can we get into the publications part? What are the steps to it? How to write a good research paper to the beginners?
Okay, so first and foremost thing I'll tell you, this is an advice given to me by my postdoctoral mentor, Professor Eli Perry, when I was coming back to India. So one thing Eli told me was, he said, don't go and publish for the sake of, oh, this is from Indian study, from Indian eyes. Okay, so you're doing the same thing, and then all you have done is changing the population, unless and until there is a good reason for doing it, in case if you hypothesize something to be different. So he said, don't do yet another sort of thing. The most important thing he said is the biggest contribution you can do to science is not to publish wrong science. Okay, so when you do something in the hurry to publish something, you end up saying something that is very wrong, because afterwards, when you yourself do 10 experiments down the line, you realize whatever you have published earlier is wrong. Okay, so he said, don't publish. The biggest contribution you can do to science is not to publish wrong science, because once it is published and out in the world, then some vulnerable student might read up and then they might think, oh, this is true, and they can pursue a whole PhD project based on that paper. You understood? Okay, so then you are misleading somebody and you don't even know whom you have misled when you're publishing wrong science. So therefore, before you publish a paper, first ask the question, why am I publishing this? What is new in this? What is it that I did not know already in the literature that I'm now contributing something new? Okay, if you have clarity for that, if you know exactly what is new in this that is already not known in the literature, then right there you are having a good publication. Okay, if you think, okay, this is a valuable information, I did not know this before, okay, here is something new to learn, so that if you have the answer to that through your research, then by all means go ahead and publish it. Okay, so that's first. Asking a very good research question with good hypothesis and scientific basis for why you think this should work or not work, etc. Okay, that's one. And the next thing is, once you have identified and you know that your work is good, okay, and you have gone through the rigors of research, which is like making sure it's done ethically, that is, you're not fabricating data, falsifying data, you're not plagiarizing, all those rigors of research. If you have gone through all of that, and if you know it is a good paper, then you should be looking at journals that are highly ranked, peer reviewed, and that's already in a good standing. There are hundreds and thousands of journals. Okay, if you just go to Google and say what are the top 100 journals in ophthalmology or vision science, they are going to list it out for you. Okay, then look at the scope of the journal and see which is your target journal. Where do you want to pitch this paper? Okay, so if it's very clinical, optometry dense, then go for optometry and vision science, or clinical and experimental optometry. So you know the domain areas. Where are such kinds of papers published? Similar kinds of paper published. That's where your peers are reading it. Okay, and that's where you want to be, projecting your paper there. So choose your journal wisely and then go through the review process. It will be intense. They will, come back with a lot of questions and all that. And if you can defend all of that, revise your manuscript, submit it back again, then you're done. Okay, so that is, so it really, how you package is also important. As I said, I have had a lot of rejection sometimes. it doesn't come out in the way I want it to come out. I might say it, but I'm not writing it. Okay. And many a times I've had rejections, and every reviewer gives you some good comments. And as you keep revising and improving your paper, eventually it will get into a journal, because now you have addressed all the potential reviewer comments through your earlier rejections. So don't close it. If it's good work, don't close it if you have got rejection from reviewers, but address those reviewers' comments, because that's what is getting the paper, making it better and better. So then you can eventually publish.
So here I get this that don't be disheartened by rejections. I think rejections are good, uh, and it is a positive
Good
thing.
rejections are good. Okay, there are journals that will reject for with one line saying, "Oh, this is not of interest to us," and they would have published papers like this. Okay, I don't want to name these journals, but they exist. Okay, and so then that's a journal you don't want to go back to, because that review process was not fair. But there are journals that will reject you, but with good reviewer comments. That's the journal you want to go back.
Okay, so it's a good point that we should not be disheartened, but yes, select wisely. Second one is which what are the topics we should consider? Like for example, if I'm getting into research, if I'm getting into my masters or my PhD, and I want to work on a project which is close to my heart. But sometimes the guides and the professors or they want us to do some other project which is like in the market and it is in trend. So should we go about the trend? Like, for example, myopia is in trend right now. So we usually take topics which are in trend, which everybody else is doing. Let us do on myopia. Let us do on this subject. So what should we go for? Like we should follow our heart, or what, or we should go into the literature, search for a topic, and get into a project, or we should get into what others are following.
I think that's a very personality thing, Neha, because honestly, I did what I liked. Okay, and I told you this is why I'm pinning back to my first patient, the sixth grader with nystagmus. It was always eye movements, okay, low vision and all of that. So I've always stuck to that path. Okay, so the journey I can always trace it back and say why I ended up. I'm like looking at nystagmus right now. Okay, and this is on babies with congenital cataract. So the common theme has always been eye movement. So even the device we built was actually looking at eye movements. Okay. So somewhere I'm able to trace it back, but that doesn't mean that's the only right thing to do. Okay. I think these you need to work hard and you need to work smart also. Okay. There are people who are like, okay, you get an exposure for doing research, and there is funding only in myopia. I let me learn the tricks of the trade. Okay, I go do myopia, but then I come back, and now I know how to do a rigorous research. But my heart is was never in myopia. Okay, and I want to switch to hemianopia,
Yeah.
right? And you can still perhaps apply the same principles, because what the research are at least as a degree thing, right? As getting a PhD is, it trains you to do critical thinking.
Yes.
So you will see there are some researchers who have started out their career with neurophysiology. They end up now with something else, okay? But they might always trace it back and apply some concepts, okay? So which is why in the US, especially for postdoctoral training, fellowships and grants, they will want you to do a PhD in a certain subspecialty, but when you're applying for postdoctoral grants, they want you to shift to a completely new area, because only then you can get new ideas and do cross-disciplinary, and you might evolve up much more because you're bringing in different perspectives. So there is nothing wrong in either going with your heart or going where funding is, provided you have the clarity eventually where do you want to end up. When I was in Ellie's lab, I was working with all older patients, but I've always wanted to work with children. Okay, but the skills I've learned there is now I'm something able to transfer to the children world, right? So there is nothing wrong as such, provided you have the clarity. But if you are like, okay, I don't know where I want to go, I'll do this because this came up, I'll do this now because this is where the
Yeah.
funding is, then what happens is then you don't know, you may question yourself, like what am I an authority in? Am I a scholar in one certain thing? Okay, that might be the missing part. Okay,
Hmm.
so as long as you have a clear picture, it might appear like you're sort of like diverging in different branches, but the trunk comes down to the commonality. But if you don't know where your root and trunk and base is, then you might feel lost.
I think you cleared one of my major doubts I had since very long about getting into different parts of optometry and following your heart. Thank you, ma'am. So coming to the next question, where we you're also a vision rehab person. So what can you put some insight on your innovation, the pediatric perimeter, which we have already seen it, and how it is helping around, and what is the progress in that part?
Okay, so one thing is as a clinician, I'm more in binocular vision, vision therapy, and all that. And as a researcher, well, also as a clinician, I work with patients having hemianopia. I do telemedicine fitting and all that. Okay, so my rehabilitation sort of is at that level. But then I also do research on visual functions and functional vision, right? So how are people using vision to do their activities of daily living? Okay, so we have had research looking and validating tools that we can use in children with special needs, etc. As a part of that, we developed this device that was originally called pediatric perimeter. Now we are actually calling it as BAVIS, baby vision screener. And the reason why we removed the terminology from perimeter to much more broader baby vision is because we realized we could quantify a lot more. Okay, and there are some papers that will be coming out, and you would see that to realize the scope of this device. So with this device, we initially, as I said, my sort of like interest was children with special needs and realizing that they don't have tools adequate to test them. So we had a need and we were filling that need, that gap. We built the device and it allowed us to realize, okay, how much of a field they have. But in that process, we realized there was a time that these kids were taking towards the stimuli, the reaction time. And then we realized that this reaction time seems to have an age-related trend. Okay, and we realized that, oh, you can actually open up this beyond babies or children and even do it on adults who have cognitive impairment. Okay, so we had a recent paper that talked about how we could do this on patients with epileptic seizure. And the neurologist and the neurosurgeons actually will want to do field testing, but they cannot endure the regular mouth field. So the recent paper, we worked with neurologists in our city, in a city hospital, and we had this paper and we showed the scope of this device to open up for these patients also. Okay, so presently, the device, we are working with an industrial collaborator and they are going to hopefully bring out the commercial product. It's a long journey. It's a very long journey because we don't have anything like this in the market for us to study it and then improve upon it to cut down cost, or we don't have any gold standard. Okay, so that's why it's taking a lot of time because we have to validate every single process in this and look at feasibility and multiple aspects like that. But hopefully, I hope the product comes out soon because then I will be the consumer of the product rather than being somebody who's actually making the product. I would rather use the device myself and do a lot of research with that device. So I'm also eagerly waiting for the device to come out as something that's available in the market. But hopefully, we should be there pretty soon. That's the hope.
That's a great idea and a great innovation for the betterment of the society. So that's what comes out, that whatever research we are doing, it should be impactful and be clinically impactful in the society as well, and reach a lot of people and help clinicians to diagnose disease, help patients. So we are just I think we are awaiting as well, eager to learn more about it in the future. So coming back to vision therapy, as you said that as a clinician by heart, you are a vision therapist and a functional vision therapist, and you are into functional vision. So can you put some light on an incredible story you came across through vision therapy sessions? Any story of a patient you want to share with us?
Yeah, I can share that, but before I go there, I just want to clarify something because I don't want people to think that they always have to do incredible, impactful research and all that. And I'll give you another story. Okay, and the reason I'm saying this is especially space research, okay, physics. People do things they discover, and many of the physicists who discover have no idea how this whatever that they discover is going to have a bigger impact. It might be one small equation or something like that. But down the line, a lot of medical transformation has borrowed ideas from physics and space research and they have transformed it. And the beautiful example is the aberrations. Okay, so the adaptive optics, all of that was used for stargazing. Okay, to make sure there are no aberrations when we are imaging stars with telescopes. But now we are using the exact same technology for doing your LASIK and looking at adaptive optics, fundus imaging, and it has revolutionized. So
Yes.
all I want to tell people is you don't start out saying I'm going to make a groundbreaking research. Okay, we don't start out that. You
Yes.
just address one problem, whichever domain you are in physics, chemistry, wherever. But then the implication of it, if it is a good research done in that area, it might have a ripple effect on other fields. Okay, so I just want people to they are not going to go in and say, okay, I'm going to fix eye cancer and that's what I want. Okay, you might start out somewhere, but eventually it might have that implication. Okay, your vision therapy story that you wanted,
Great.
right?
Yes, yes.
So I once had a patient who actually had a traumatic cataract, okay, when he was a child, and he underwent, the lens removal, and he had an intraocular lens at a later age. But then his eye went into decompensating exo and all of that, and then when he came back, no, actually he didn't get an IOL. He left it afflicted, and then it went into decompensating exotropia. So when he came to us, okay, and at a young middle age, a young adult, like 25, 28, some age range like that, okay,
Yeah.
and he was now cosmetically concerned about his exotropia. So
Okay.
the first thing, of course, is we rehabilitate him, give him best vision possible. So we put him on contact lens. Luckily, his cataract happened after his critical age of development, so he wasn't too bad. He still was hitting about 20, 40, 20, 30. Okay, so somewhere 612, 6 9ish, something like that. Okay, so after the contact lens, and then he had to be operated for his tropia because you can't give any convergence exercise on a frank tropia. Okay, so I was trying to push him for the surgery, and then he was very worried whether he have double vision and all that. So we gave him a Fresnel prism. He tried it for 3 months. He was comfortable. He hesitated quite a lot because he was always worried how the surgery would go and all that. So eventually he got corrected. Okay, and then after the post surgery, he still had a small amount of exo deviation, and we gave him vision therapy and all that. And he also needed a little vertical prism, very small. So once we put all of that, okay, and then he did all his exercise that he had to do, and then his eyes were straight, and he looked as normal can be. He came back and he told me that, I am a very different person now. My whole personality has changed. My friends are saying that I have become more social. I can make eye contacts. I always had the fear of interacting, especially with the opposite gender. I was very shy and I couldn't make eye contact, and I would always run away from crowds. And he says that my whole life has changed. So that simple cosmetic correction, proper refraction, and just having somebody sort of train them and give them the 3D depth made me realize how much of an impact it could have on the bigger issues. Many of our patients come and they don't give you deep insights of how things have changed for them in life. They usually say that they are very happy, I can see clearly, no more double, all of that is what they say. But when he went through this whole reel of what all has changed in his life and how he's getting a promotion in his work because now he's able to communicate better and all of that.
Yeah.
So we don't we underestimate the role of vision in the bigger picture of life itself. I thought that was a very inspiring. I mean, I have a lot of other stories too, but this one stuck to me because it sort of, he gave me a whole history that I never asked for, and that one little thing that we could do for him changed it. So people should be very happy that we work in a field where we can really impact lives to much greater extent than what we think beyond your six vision.
Yes. So vision, it's not only quantification of the vision, but it also the quality of vision, what we get it through a customized approach, I would say, and a systematic clinical approach with
Yeah,
vision therapy.
quality of vision and quality of life, therefore.
Quality of life, therefore. So, for our audiences, for our listeners, could you please explain us about, in simple terms, what is functional vision and why it is an important focus area?
Yes, so functional vision, an example is, am I able to pour water into the cup? Okay, that's as simple as that. And Patients come to our clinic actually with functional vision complaints. They are telling you that I'm not able to type on the keyboard, I keep mistyping, I'm not able to see the bus number, I'm not able to see the friend's face. Okay, I'm not able to identify my friend or mother in a crowd. That's your functional vision. And so when we write the chief complaints, we are actually writing it as per how patient tells us. And
Hmm.
what patients are telling you is functional vision complaints. That's how you should write it. If you were originally out to write the chief complaint in patient's own words. So we take note of their functional vision complaint. Then we go and measure visual functions, which is your black and white letters, and it has got no relevance to a bus number or to the friend's face. Okay, this is the disconnect. This is why many a times, and I hear this from LASIK surgeons also, they tell me that my patient got 20/20 visual acuity, but they are so unhappy.
Yeah.
Okay, and that's because there is a functional vision component that is missing. So you might have to probe deeper into the other visual functions to be able to quantify that. So we are, as a part of our research aims to look at functional vision aspects and see if we can quantify that. So by that I mean like we do experiments with visual search. Can you identify this face amongst a group of people? Okay, so that's why we are doing research like that to see how is it relating to certain aspects that cannot be explained through visual functions that you are quantifying in the clinic. Okay, so that's why it's important to also measure functional vision or do research in that aspect because at the end of the day, you want them to become functional.
Yeah. Thank you for such a simple explanation of functional vision, and it is an important aspect in clinical practice as well. So now we are coming towards the end of our podcast. We have a section called rapid fire, but before that, I wanted to ask you, for all young optometrists and students listening, what's one piece of advice you would give them, especially those who want to combine research and clinical work? And what is one piece of advice you will give to the future optometrists as well, for the young generations?
I think more than an advice, I will ask them to ask the question why. Okay, if you're asking why are you doing this, why am I doing that? If you are able to answer that question, then all your answer lies within that question. Okay, so uh, I'm going to go to private practice. Okay, so say why. And if you know why, if you're very clear with that, then you don't need anybody else advice. Okay, so and in case if you're not sure why you're doing it, then open up yourself to experience different things. Okay, choose a fellowship program or go get into some training program that allows you to give a wide scope of practice in different areas. So once you go through that round of rotation and try your hand in different spheres, then something might appeal to you more. Okay, so when you have that experience, then you are able to make a bit more informed decision. Okay, so don't go by I like this person, I want to be like them. Okay, no two people are very same. All right, so you need to have your own life journey and you have to have your own experience to decide why you're doing that. Okay, so go by that. Don't get influenced. You might have some role models and mentors, but that doesn't mean you have to do exactly the same thing that they did. Okay, so have your own experience and you are your own best teacher. Actually, your experiences are your own best teacher.
Thank you, ma'am, for such a great advice. I think understanding your own strengths and weaknesses are very important. So now coming to the most exciting part, which I love it is rapid fire questions. I'll be shooting some questions to you, and you'll have to answer us, Mr. C. So uh, it will be a quick, fun question. So the first question for you: your favorite subject during optometry school?
Binoculars,
Research or clinic? If you had to pick one for a day.
research,
Okay, a book or movie that really inspired you.
uh, both.
Okay. One gadget or tool you can't live without at work.
My computer.
Great. If not optometry, what would you have become?
I actually joined BSc Physics. I think I would have become a physicist.
Physician. Okay, great. A city you'd love to go back to.
Sorry,
A city you'd love to go back to.
I didn't understand the question.
A city, a city you would go.
Oh, a
Your
city.
favorite city? Yeah,
Oh, Boston.
Boston. Okay. Uh, what are the three books you advise every optometrist to read?
As in like clinical books, study material books, or you're saying like novels, anything?
Study material for optometrist. Yeah.
Oh, okay. Then primary care optometry,
Yeah.
Borish clinical refraction, of course, and Kansky. I think if they do these three, if they read it from cover to cover, I think they are there. They are ready.
Okay. Okay. So your go-to stress buster.
Um,
Reading.
uh, I mean, I suppose I do Sudarshan Kriya, yoga.
Okay. Wow. That's an. We've not explored that part of yours. Sadly. Okay. One word to describe the future of optometry and vision care in India.
Very hopeful. Hopeful is the word.
Very hopeful. Thank you. I think great answers. Answers that was true fun. And we got a lot of insights from you, ma'am. Anything else you want to add it and share it with our audience?
Okay, well, first of all, I should say, Dr. Neha Chaurasia, it was fun interacting with you. Thanks for putting this together. I realize you guys are doing this because you're trying to inspire a whole lot of people whom perhaps you will never meet also. So that's a very noble thing that you all are doing. And I hope it reaches out and it makes a difference for at least some people in their lives. I don't have anything much to add. There is a lot of things out in the internet these days, many videos, all of this. Uh, so therefore, it's in a way it's information overload, but somewhere people need to sort of consume things and consume it wisely. So be very choosy in what you're picking up because you only have limited time. There are too many things also. So choose what you want and so always ask that question: Why am I doing this? Or why should I watch this movie or read that book? Okay, so go by that. That will help you with life choices.
Yeah. Thank you so much. Time is very precious, so select the best one. Okay. So thank you, Dr. Premnandhini, for joining us today. It was such an inspiring conversation for me, and my lot of my doubts on research got cleared. That which path to go, if whether I'm doing correct, where I should stop, all that. Thank you so much. And I think for our audiences as well. To all our listeners, we hope this episode gave you a deeper understanding how research and patient care can go hand in hand. So if you enjoyed this episode, don't forget to follow OptiSphere podcast channel, like and subscribe, and wait for more such episodes. Thank you so much. Thank you, Dr. Prem Nandini. Thank you
All
so much.
right, have a good day. Bye.
Thank you. Bye bye.
Bye.